Well, hello and welcome to today's episode of Talking HealthTech. I'm here with a few amazing women from Women's Health Road. We'll start today by finding out a little bit more about who they are and what they do. So, Khika, can you introduce yourself and tell us a little bit about what your role is?
Absolutely. So my name's Khika. I'm the practice manager here at Women's Health Road and general wrangler of projects. And so it's been really wonderful being part of this team. My background, I've got quite a few years in pharmacy as a dispensary technician. So seeing that from the prescribing end of things, it's been really great being able to help out the clinicians here to make sure that everything's going through as smoothly as possible and patients are really understanding the medications they're being prescribed. And then my academic background is in women's autonomy in healthcare. So that's really come to the forefront here, working at Women's Health Road and making sure that every interaction we have, every patient step is really with the woman in the driving seat. And it's just been really wonderful experience working with the team and being able to move forward on so many projects that we've been working with here as well.
Amazing. Thank you. Maria, can you introduce yourself?
Yeah, definitely. So hi, everyone. I'm Mariah. I'm the media manager at Women's Health Road. So in my role here, I manage our online presence and create digital patient education and advocacy, which is truly a fundamental pillar of what we do at WHR. By day, I work as an AI consultant at KPMG, and this experience allows me to bring innovative solutions to WHR and, transform how we work and how we deliver healthcare to our community.
Amazing. And Dr. Megan?
Yeah, so hi, I'm a GP and I've been working across a number of areas in general practice. And my main areas of interest within general practice are women's health and sexual health. And I recently completed my Masters of Public Health because I was interested in a more upstream approach to improving health. I'm also just interested generally in the digital transformation of the healthcare system.
Great, thank you. Maria, so for a few of our listeners, they may not know who Women's Health Road is. Can you give us a bit of a background on the clinic, its story and its mission?
Absolutely. So Women's Health Road is dedicated to providing comprehensive and compassionate healthcare for women at every stage of their life. Our mission is to deliver high-quality, multidisciplinary, hybrid care that addresses the unique needs of women, from routine checkups to specialized treatments. I would say that as a clinic, we really pride ourselves on our holistic approach to care, which integrates technology, including AI, which we'll touch on today, and patient education to ensure that every woman receives personalized and empowering healthcare. Yeah, I think one of our standout features at the practice is that we've launched Australia's first Abnormal Uterine Bleeding Hub, which is for abnormal periods, where we offer a number of services under one roof, which, we'll talk to as well.
Running practices in this day and age often requires integrating a lot of different platforms to meet the needs of the practice and also the community that you serve. Khika, can you tell us what interoperability means in the context of healthcare and Women's Health Road?
Absolutely. So we're a really digitally inventive practice here, and so interoperability is at the heart of everything that we do. So making sure that all of the different technologies that we use, all the programs, speak to each other and therefore can be easily passed along to the patient, to any other clinicians that are involved in their care, as a multidisciplinary team as well. That's really important because we need to make sure that the patient's record is in one centralized space that's really easy to access and the patient has access to it, and so do the relevant clinicians with the patient's consent. So in this case, we use quite a few different tools. Our central ones are MediRecords, which is our patient management software. They are an absolutely wonderful team. We transitioned to them last year, and they've been fantastic in terms of patient management, being able to interact with patients and send them any educational materials we want. In terms of interoperability, MediRecords is really excellent at making sure that we can speak to our Heidi, which is the AI tool that we use that Mari is going to speak to a little bit later as well, and making sure that we have this centralized location where all of the reports, investigations, results are all in one place, easily accessible for other clinicians, and the patient can access them as well, so that there's no barrier between the patient's own records and them having access to them and fully understanding their own health journey. Also, in terms of how our different tools speak to each other and work, we, as Mariah mentioned, we're working on and have developed the first AUB pathway, which heavy menstrual bleeding in particular affects 1 in 4 women, which is a really quite dire statistic. And so we're doing everything that we can to help alleviate the symptoms, really make sure that women understand this issue and that it is abnormal. It's not something you should be living with. And so the tools that we have allow us to make sure that all of the steps along a woman's journey in terms of abnormal bleeding can be really easily accessed and ticked off, basically. So things like making sure that they've had their iron studies done, that we can do an infusion for them, that they've had the ultrasounds that they need, and those are all in one place. For instance, we do ultrasound here on site, and so we're making sure that our reports are easily accessible, can be sent out to other clinicians, and then the overall quality of care is just a lot higher because you have this streamlined experience for the patient. All of our tools work together, and that Abnormal Hub is really important and central to this as well.
Really bringing everything that the patient requires at that one point. Dr. Megan, what's your experience been as the clinician working this way?
I found it really good because it allows me to focus on the patient. It allows me to focus on the patient without having to worry about taking notes, and frees up more time to spend with the patient rather than note-taking and, printing out lots of different pieces of paper for different referrals, things like that. So it means less admin at the end of the day, and not just from a time perspective as well, but also from sort of a focus perspective. I'm able to sort of look at the patient and listen to them with my whole body rather than sort of having to sort of pivot and type notes, which I found really beneficial. And I found it, reducing that friction makes practicing medicine a lot more enjoyable.
I know when we talk about enhancing that clinical decision-making process, we often think about, well, how are the tools actually doing that clinical decision process? But what I'm hearing from you is by reducing that friction of having to type notes, you're able to really engage with the patient, and it's enhancing your ability to really get a full story and improve your clinical decision-making as well.
Yes, definitely. Yes.
Amazing. Mariah, I'm dying to hear a little bit more about the AI tools that you're using within Women's Health Road, and then also a little bit more on how, so a theme that keeps popping up is patient education and advocacy. So I'd love to hear a little bit more about how you're bringing all of that together within the practice.
Definitely. So I think Megan definitely covered a lot of the benefits of Heidi that we're seeing at the practice, which is our AI scribe. I came into the practice earlier this week and we were showing someone how it works. And Khika did a fantastic demonstration with someone. And I think the thing that really stood out to me and to the person she was demonstrating the tool to was just that level of eye contact that she was able to maintain with her patient, which wasn't really a patient, but I think that's also been a big win in terms of having the AI scribe. But I think, coming back to the patient education and advocacy piece, as I said, we launched Australia's Abnormal Uterine Bleeding Hub, first Abnormal Uterine Bleeding Hub, but related to this is Bleed Better, which was an international advocacy campaign which we ran through our co-located charity. And the purpose of this campaign was to shine a light on the 1 in 4 women of reproductive age whose quality of life is impacted by heavy menstrual bleeding. And so whilst heavy menstrual bleeding can impact, all women of reproductive age, it definitely tends to cluster at the adolescent and perimenopausal age. But yeah, I think in terms of the advocacy, we had, specialized panels with clinicians who discussed their experiences with, treating HMB and created a lot of resources for called communities and rural communities on HMB as part of that Bleed Better campaign.
That's great. Thank you so much. So in terms of the strategies that you're using, I guess you've developed a lot of resources. So they're freely available online and some panels. So that's sort of some video content that people can consume when they are looking for that as well.
Yeah. I think actually just, hearing you say that has sparked that a lot of, the medical terminology out there is quite advanced. And so something that we tend to do is simplify that and make it accessible for people to understand and really be empowered about their health journeys. And
yeah, such an important part, improving that, meeting our patients where they are with their health literacy.
Yeah.
So if we're bringing it all together with what's happening at Women's Health Road, Khika, can you talk to us a little bit about what's next for Women's Health Road?
Absolutely. So adding on to what Mariah was saying, particularly in terms of making sure that the resources that we're able to give to patients are accessible to them, because it's all well and good to send them the college, the Ranscog College papers and say, yep, have a read of this 50-page document explaining the ins and outs of a hysterectomy, but that is going to go right over someone's head if they've got 3 kids they're worrying about and need to be just giving the really quick understanding of what this means so that they can have a better starting point to ask the relevant questions that they need that relate to their lives. So something really important to us is expanding on the research and materials that are available in this area. So we've applied for quite a few grants and have a few projects in the pipeline that are making this more catered to the specific demographics that are affected by these issues, especially abnormal bleeding. So, for instance, if you've got a 14-year-old coming in, at the moment, there's kind of a one-size-fits-all patient education document that's been really helpfully provided by the College of Obstetricians and Gynecologists. But it includes in equal weighting both hormone therapy and a hysterectomy. Now, a 14-year-old may or may not be needing to address that just yet. And so for something that's going to cater to her specifically, we want to make sure that what we're giving her in terms of educational content and understanding better the conditions that she's experiencing is catered to specifically her age, her experience, her cultural background, especially in terms of languages. So we do have quite a diverse group of patients that come to us. Our wonderful clinicians, quite a few are multilingual, which means that we can really offer our services and expertise to an even greater population. And in developing these tools and resources as well, we want to make them available to as many people as we can. So not just our own patients, but for people who are looking up, oh, I've had really heavy bleeding, is this normal? And instead of taking it to Dr. Google, which we all know send anybody into a spiral, we want to have them with really evidence-backed, really well thought out and relevant information and education specifically for them. And for that to be part of our patient experience as well. So they come in, before we even book them in, we go, oh, have you had all of these initial checks, which we want to be able to have as a resource that we can give out to clinicians as well, to know that these are the things to do first before sending on to specialists. Because it means the patient gets the most out of their time with different clinicians and they're getting the fastest and most effective care. So we know that we've already done the iron tests, they've done any infusions that might be needed, we've done the imaging. And then we're going forward with, okay, these are the kind of higher level questions that really do need a specialist. And then we bring the patient in to see that specialist. They do a full workup. They really understand what's going on. So our gynecologist here, director, Dr. Talat Upal, she is championing the Abnormal Bleeding Hub and really wants to make sure that every woman comes in and really is seen and heard and then leaves feeling much more empowered and educated and understanding what they're doing. So being able to then incorporate that patient education that we're developing into our patient pathway through MediRecords, we can send it directly to the patient and they've got that record to go on with. And they might well have friends who are experiencing similar issues, family members. They can pass this education on to them. We want it to be really freely accessible and something that just kind of joins the zeitgeist of conversation surrounding these issues. So it's a lot more accessible, better education, and really understand what they're experiencing and how best to treat it.
Great. So I feel like you've potentially answered this a little bit, but in terms of the virtual pathway that the patient experiences while engaging with Women's Health Road, can you delve a little bit more into that for me?
Yeah, absolutely. So as I mentioned, we kind of have the pre-appointment, during the appointment, post-appointment, and follow-up from there. So we're working to really expand the accessibility of that pre and post-appointment for as many women as possible, because the more women who are educated and understand this issue and can pass on that education and understanding, the better we are as a society, health-wise, mental health-wise. There's so much lost potential with women who can't go to work, can't play sports, can't go to school with this bleeding because it's just so disruptive to their lives. So we want to make sure that in the intake we're creating something that's really interacting with the patient. Mm-hmm. So they come in into our sort of virtual landing page, I would say, which at the moment is through our website, and we're developing with Telstra Health and a few other partners ways to make this more interactive. Heidi itself also has an intake platform that's an interactive way of doing new patient questionnaires. So rather than our 5-page gynecological history, which includes everything from your first period to pregnancies to menopause, we're not going to give that whole thing to a 14-year-old. So we want it to be catered again. So even the intake is catered specifically to the kind of patient we're seeing and their background. So making sure that all of our intake forms and our first interactions with patients are using evidence-backed education and questions that we can then include in research, de-identified, to get a better understanding of the health issues that are facing women with these concerns. And then once they're in the appointment, we've already taken all of the prior information ready to go. We want to be able to kind of live compare what the patient reported in their initial expression of interest for an appointment versus what the clinician is understanding in the appointment, and making sure that there's a comparison there between this is what the patient understood, this is the clinical understanding of that same issue, seeing if there's any differences or gaps that we can clarify for the patient as well, and then making sure that after the appointment they have a really good understanding of what their treatment pathway, a treatment plan is, whether that be surgical, hormonal, medications, contraceptive options, long-acting, things like that. We want to make sure that they really understand what their options are. So for an age-appropriate patient, someone who's perimenopausal, finished with their fertility, we want to make sure that we're offering them the full hormonal option all the way up to the hysterectomy, if that's something that they're interested in and that they think would benefit them as well, under the direction of the clinicians here as well. So making sure that that information is really accessible to them, is relevant to their stage in life, and really understandable as well, because there's nothing you want more than facing a giant surgery, life-changing, as far as you understand, like it's the biggest thing you've ever had, and the only information you get about it is all in 5-syllable words or more. So we really want to make sure that it's something that the patient can understand, can interact with. So if they have questions, it's something that can be clarified as they're reading along. And then at the end, come back to us to confirm the treatment plan with really well-informed questions, really understand the information that we have given them, so that they're moving forward, being able to share this information with other people in the community, and also really knowing that they're the one in the driving seat of their care. So they've been given all the options, then make a really informed choice, and then we've found that that is always the best outcome for patients and clinicians alike.
Yeah, wow. It's really exciting to hear how proactive and encompassing Women's Health Road has been in not only tackling this particular issue, but I imagine your approach to all women's health issues and the community that you serve. Before we wrap today, do any of you have any additional thoughts or takeaways you'd like to leave with our audience?
I think that one of the things that a lot of people worry about is AI sort of taking their job, so to speak. But I've actually found it to be the opposite. I found that AI has been really helpful in freeing up my time and energy so I actually can see patients. That's something that that's my takeaway. Yeah.
Yeah, and isn't it amazing? Like we've sort of evolved with so much technology now. I know that when I do a clinical shift, I have a computer on wheels that I walk around with, and sometimes it takes away so much from actually being able to look at your patient and spend time with them at the bedside, that when you can remove that and actually give your patients the care that they need, but engage with them one-on-one at a human level, it's really, it's wonderful for the patients, and they get such a better outcome. They feel far more empowered in the process and their journey. So all about, trying to find ways to alleviate that administration burden, I think is wonderful. Yeah. All right. Well, guys, thank you so much for your time today. It's been an absolute pleasure hearing your perspectives and the good work that you're all doing at Women's Health Road. So thank you.
Thank you so much for having us, Sophie. It's been wonderful.
It's been an absolute pleasure.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.